Hello, so today we will discuss about photoretinitis. Let's start from introduction. Photoretinitis is also known as solar retinopathy, or eclipse retinopathy. It refers to retinal injury induced by direct or indirect sun viewing. Commonly solar retinopathy is associated with religious sun gazing, solar eclipse observing, telescopic solar viewing, sunbathing, and sun watching in psychiatric disorders. Causes of photic retinopathy. Causes other than solar retinopathy are welding arc exposure, lightening retinopathy, and retinal phototoxicity from ophthalmic instruments, like operating microscope. The pathogenesis of the disease. Solar radiations damage the retina through photochemical effects are produced by UV and visible blue light, and thermal effects may enhance the photochemical effects. The long visible wavelength and infrared rays from the sun are absorbed by the pigment epithelium, producing a thermal effect. Therefore, severity of lesion varies directly with the degree of pigmentation of the fundus, duration of exposure, and the climatic conditions during exposure. Let's discuss the clinical features, symptoms. These include persistence of negative after image of the sun, progressing later into a positive scotoma, one which appears as a dark spot in the visual field, and metamorphopsia, objects appears distorted, unilateral or bilateral, decreased vision 6/12 to 6/60 which develops within 1 to 4 hours after solar exposure, usually improves to 6/6-6/12 within 6 months. Signs. Initially the fundus may appear normal. Shortly after exposure a small yellow spot with gray margin may be noted in the foveolar and parafoveolar regions. The typical lesion, which appears later, consists of a central burnt-out hole in the pigment epithelium surrounded by an aggregation of mottled pigment. Ophthalmoscopically, it appears as a bean or kidney-shaped, pigmented spot with a yellowish-white center in the foveal region. In worst cases, typical macular hole may appear. The treatment and management of the disease. There is no effective treatment for photoretinitis, so emphasis should be on prevention. Eclipse viewing should be discouraged unless there is the proper use of protective eyewear filters, which absorb UV and infrared wavelengths. The prognosis is guarded since some scotoma and loss in visual acuity by 1 or 2 lines mostly persists. That's it for today.